July 2, 1944. Feel the moment near Cherbourg, France, as a figure emerges from the deep subterranean gloom of an underground hospital cave. Dr. Schwester, with a white medical coat draping her frame, lifts her hands in a clear sign of surrender, her eyes painfully adjusting to the brilliant, piercing daylight that had been absent from her world for days. It is impossible that the Americans possess the medical supplies they boast of. This must be a fiction, a propaganda tool designed to crush our will. These very thoughts, whispered to her fellow nurses just hours before in the cavernous hospital carved far beneath the Cherbourg fortifications, were about to become the first of many deeply held beliefs to be utterly demolished. Behind her, a line of 8 other German army nurses followed her path into the sun, becoming some of the very first female German medics captured by American forces during the French invasion. They had endured the siege's final desperate days, treating the wounded soldiers of the Wehrmacht by the flickering, uncertain light of tallow candles, carefully doling out their last precious vials of morphine, and endlessly boiling and reboiling bandages for reuse. What not one of them could possibly fathom was that within a few short hours, they would bear witness to a medical reality so potent it would invalidate everything they had been conditioned to believe about American fragility and German might. These 9 nurses, taken captive after performing their duties in circumstances more akin to medieval butchery than contemporary medicine, were on the verge of encountering a medical infrastructure so astonishingly advanced, so incredibly well-stocked, that it would not only dismantle their professional understanding, but shatter the very bedrock of their entire ideology. Colonel Richard P. Johnson, the commanding officer of the 45th Evacuation Hospital at Lam, observed them not with hostility, but with a deep professional curiosity. They were enemy medical personnel, yet they were also fellow healers. In a matter of days, these very nurses would be returned to the German lines, all in accordance with the protocols of the Geneva Convention. In total, 16 German nurses were slated for exchange on the 2nd and 9th of July. But before that could happen, they would be given a tour of American medicine, 1944 style. They would see pharmaceuticals they had only heard of in whispers and surgical procedures far beyond the scope of their training. The psychological imprint of this experience would endure long after their brief period of captivity concluded. The great unraveling of their certainty had actually commenced more than a year prior, on May 13, 1943, under the searing Tunisian sun that baked the very air. General Hans-Jürgen von Arnim's capitulation involved not merely his combat soldiers but also thousands of medical staff, doctors, orderlies, and among them, the DRK Schwestern, German Red Cross nurses who had faithfully served with Rommel's Afrika Korps through 2 grueling years of desert conflict. Among those captured was DRK Schwester Ilse Schultz, who had just been awarded the Iron Cross Second Class in April 1943, making her one of fewer than 20 women to ever earn this honor during the war. Her colleague, Dr. Schwester Greta Falk, also a recipient of the Iron Cross in that same April of 1943, meticulously recorded observations that would one day be unearthed in German military archives. In a single day, the Americans discard more medical supplies than we would receive in an entire month. They possess medicines that we have only ever heard spoken of. The sheer magnitude of the surrender was breathtaking, numbering between 250,000 and 275,000 Axis soldiers, a figure that included the medical teams from elite units such as the 21st Panzer, the 15th Panzer Division, and the 90th Light Division. While the majority of the captured medics were male doctors and orderlies, it was the nurses among them who were destined to undergo a uniquely profound ideological collision. The American processing of these prisoners adhered strictly to Geneva Convention rules, executed with a remarkable degree of efficiency. At collection centers in Tunis, American medical officers sorted through the captured medical personnel within mere hours. Those deemed necessary for treating the German wounded were kept, while the rest were slated for evacuation. Every single captured nurse underwent a thorough medical examination, a procedure conducted with equipment that had long since become a rarity within the Afrika Korps. By June of 1943, the initial contingents of captured German medical personnel were stepping aboard Liberty ships, bound for the United States. These mass-manufactured vessels were themselves a stark refutation of German propaganda that painted America as an industrially feeble nation. The medical facilities on board these ships surpassed anything the German nurses had witnessed, even in their own homeland. Operating theaters bathed in steady electric light, fully operational X-ray machines, and refrigerated storage for medicine were all standard features. What was most astonishing, however, were the stockpiles of blood plasma, properly typed and preserved units that could be administered with confidence. A world away from the dangerous direct transfusions the German forces were often forced to risk in the field. The 2-week voyage across the ocean served up a daily parade of American medical extravagance. Sulfur powder, a substance rationed by the single grain in German ranks, was applied with casual liberality. Bandages were simply thrown away after one use. German medical staff, who had learned to survive on the barest of rations, watched as American medics discarded leftover portions of food, an act of waste that would have been utterly inconceivable in the Wehrmacht. The ships carrying the German medics docked in ports from Norfolk to New York. Their very first look at America was a direct assault on years of indoctrination about a country supposedly crippled by economic depression. At the Norfolk Naval Base, the medical processing involved comprehensive physicals for every captured individual. Dental issues were addressed, infections were treated with potent medicines, and those who required eyeglasses received them. This standard of care was superior to what was then accessible to ordinary German civilians. The train journey into the country's interior became a rolling series of revelations. One city after another revealed hospitals, their windows brightly illuminated against the night sky. In Richmond, the sprawling Medical College of Virginia complex was clearly visible from the train cars. In Philadelphia, the imposing structure of Pennsylvania Hospital could be seen. Every major urban area they passed through boasted medical centers that dwarfed those in Germany's largest cities. During a stop in Washington, D.C., volunteers from the American Red Cross came aboard the train to hand out packages to the German prisoners of war, each containing toiletries, cigarettes, chocolate, and writing materials. The German nurses, steeped in an ideology of racial struggle, found it difficult to process this display of kindness directed at their enemies. Camp Opelika in Alabama, which had opened in September 1942, welcomed its first wave of Afrika Korps medical personnel in June 1943. The camp's hospital evolved into a singular setting where German medical professionals, educated in the tenets of Nazi racial medicine, found themselves working alongside Americans who practiced evidence-based clinical medicine. This dual-staff arrangement was in full compliance with Geneva Convention mandates. American medical officers held supervisory roles, while the German personnel were responsible for direct patient care. This arrangement gave rise to a situation without precedent: enemy medical teams operating as an integral part of the American military medical apparatus. The facilities themselves left the German nurses in a state of constant amazement. The operating rooms were equipped with devices they had only read about in textbooks, such as electric cauterization tools, fully adjustable surgical lamps, and autoclaves that could achieve rapid sterilization. The pharmacy was a treasure trove, holding hundreds of different medications in climate-controlled storage, all with expiration dates still years in the future. On July 21, 1944, Glennon General Hospital in Okmulgee, Oklahoma, was officially redesignated as German Prisoner of War General Hospital No. 1, a 1,690-bed facility run by parallel American and German medical teams. There, Colonel Henry W. Misch initiated something that would have been completely unthinkable in Nazi Germany: integrated medical teams that shared their knowledge across the lines of conflict. German nurses from the NS Schwesternschaft, who had been taught that American medicine was both weak and decadent, discovered a system that was built upon rigorous scientific methodology. The most profound challenge to their worldview came from the African American nurses assigned to the POW wards, a consequence of the U.S. military's own segregation policies that often relegated black nurses to caring for enemy prisoners instead of white American soldiers. The German nurses watched these professionals deliver expert care that systematically dismantled every racial stereotype they had ever been taught. Nothing showcased the supremacy of American medicine more powerfully than penicillin. In 1943, the United States was already producing 21 billion units of this new wonder drug. By 1945, that number had exploded to 6.8 trillion units. German medical personnel, who had been forced to operate without any truly effective antibiotics, now witnessed the routine application of this miracle cure. At Camp Forest in Tennessee, a facility that housed German POWs and featured extensive medical services, German nurses saw transformations they would have previously deemed impossible. Infections that would have been a certain death sentence in a German field hospital were completely resolved within a matter of days. In cases where German surgeons would have been forced to amputate, American doctors were able to save the limbs. The American medical officers, many of whom were civilian doctors serving in uniform, shared their knowledge with an astonishing openness. This spirit of collaboration with an enemy was a direct contradiction of everything the German medical personnel had been conditioned to believe about the nature of warfare and medicine. The American blood plasma system was yet another technological leap far beyond German capabilities. Meticulous typing, cross-matching, and preservation techniques prevented the often deadly reactions that resulted from the direct transfusions still being used by German forces. At installations like the 21st General Hospital at Ravenneauville, France, where captured German staff worked from December 1944 onward, the blood supply system functioned with the efficiency of an industrial assembly line. Plasma could be stored for months, transported over thousands of miles, and administered without even needing to know the patient's blood type, capabilities that German medicine had yet to achieve. German nurses, educated within the NS Schwesternschaft, had learned that the purpose of medicine was to serve the goal of racial purification. Their curriculum had included subjects like Vererbung und Rassenkunde, heredity and racial studies, which taught that weaker patients should be allowed to perish in order to strengthen the race. At facilities like the 12th Field Hospital's massive 30,000-bed POW operation, they witnessed the exact opposite philosophy in action. American medical staff provided German prisoners with treatment identical to that given to American wounded. Enemies were given the same precious medications, the same advanced surgical procedures, and the same dedicated nursing care as Allied soldiers. This fundamental divergence, medicine as a universal tool for healing versus medicine as an instrument of racial policy, began to tear down the very structure of their ideological world. The Christmas of 1943 delivered a particularly deep psychological blow. American organizations dispatched 500,000 gift packages to German POWs. Each box contained luxuries of a wartime world: coffee, chocolate, cigarettes, and soap. At Camp Alva, Oklahoma, a camp designated specifically for Africa Corps personnel, local church groups arrived to sing German Christmas carols. Boy Scouts came to deliver handmade cards. Even families with sons actively fighting in Europe sent homemade baked goods. The Christmas meal itself, a feast of turkey, ham, assorted vegetables, and desserts, was more extravagant than anything the German forces had experienced in years. In their diaries, German nurses recorded their profound confusion, struggling to reconcile the Christian charity being shown by their enemies with the messages of hatred preached by their own propaganda. By 1944, the Special Projects Division had rolled out a series of comprehensive educational programs. German nurses found themselves attending lectures at institutions like the University of Nebraska Medical School at Fort Robinson. The topics covered were revolutionary to their way of thinking: medical ethics and patient rights, the scientific method in clinical practice, the very method of teaching, which actively encouraged questions, debate, and even disagreement, stood in stark contrast to the rigid, hierarchical training they had received. Gaining access to American medical journals delivered yet another shock. They discovered that many of the medical breakthroughs they had considered German had in fact been developed by Jewish scientists who had been expelled from their homeland by the Nazi regime. The cognitive dissonance was becoming unbearable. As more American medical personnel were deployed to the European theater, German nurses were increasingly called upon to staff military hospitals on American soil. At the 45th General Hospital in Bari, Italy, which began receiving German prisoners on July 31, 1945, they worked under the direct supervision of Americans. The hospital, commanded by Colonel Charles A. Pfeffer, treated all nationalities with absolute equality: Allied soldiers, Italian civilians, and German POWs. The German nurses now found themselves using American techniques and American medicines to treat patients their own ideology had labeled as inferior. American medical technology appeared to be decades more advanced. X-ray machines, a scarce resource in Germany, were used as a routine diagnostic tool. Electrocardiographs, which were unknown to most German nurses, were standard pieces of equipment. At places like the 3rd Convalescent Hospital, which operated from May to September 1945, German nurses were taught how to operate equipment they had previously only been able to imagine. They learned to use autoclaves that sterilized instruments in minutes instead of hours, and electric suction machines that replaced manual hand pumps. Even seemingly minor innovations like adjustable hospital beds represented a significant step forward. The spring of 1945 brought with it the most soul-crushing revelation of all. Newsreel footage from the newly liberated concentration camps was shown to all German prisoners of war. For the medical personnel who had served the Nazi regime, this was the ultimate moral reckoning. Their initial denials began to dissolve as the evidence became irrefutable. They heard testimony from American medical officers who had entered the camps. They saw photographs, and they read letters from home that confirmed the horrifying truth. The system they had served had twisted medicine into an instrument of mass murder. American officers handled this process with professional detachment, stressing that medicine itself was not to blame, but that it must never again be allowed to serve ideology instead of healing. American authorities then introduced targeted denazification programs specifically for medical personnel. These mandatory courses focused on medical ethics and democratic principles, using case studies to illustrate how racial medicine ultimately harmed patients, while scientific approaches saved lives. Lieutenant Colonel Dorothy Whitman at Camp Opelika made arrangements for German nurses to observe American nursing practices, with a special focus on meticulous documentation and patient advocacy. The underlying message was clear: technical proficiency without an ethical foundation was simply not enough. Throughout their time in captivity, the sheer abundance of American medical resources never ceased to stun the German personnel. Hospitals would dispose of medications that were barely past their expiration dates, medications that Germany was no longer able to produce. Surgical instruments were replaced at the very first sign of wear, rather than being repaired over and over again. This apparent wastefulness demonstrated a truth that flew in the face of Nazi propaganda. America could generate medical supplies in seemingly limitless quantities without needing to conquer new territories. Germany was fighting a war for resources that America was simply creating through its industrial might. American nursing practices presented a fundamental challenge to the German professional identity. The Nazi hierarchy had demanded blind, unquestioning obedience. In contrast, American nurses operated as thinking professionals who possessed a significant degree of autonomy. They were empowered to question doctors' orders, to suggest alternative treatments, and to make independent decisions within their scope of practice. This professional model, entirely foreign to German nursing, represented a complete reimagining of their role. As Captain Helen Morrison at Glennon explained, "You are responsible for patient outcomes. If you see something that's wrong, you speak up, regardless of rank." This empowerment fundamentally transformed their understanding of what it meant to be a nurse. The presence of African American medical personnel created a state of profound cognitive dissonance. German nurses found themselves working under the supervision of black professionals who demonstrated superior knowledge and skills. Lieutenant Elenina Powell at Camp Florence, Arizona, supervised German nursing staff with a level of professionalism that directly contradicted their racial propaganda. When she corrected their techniques or taught them new procedures, the German nurses were forced to confront the absolute falsehood of their racial education. The irony of the situation was not lost on them. American segregation had assigned black nurses to care for enemy prisoners. Yet even this deeply flawed system was producing better medical outcomes than Nazi racial medicine. After Italy's surrender in September 1943, cooperating Italian medical personnel began to receive better treatment. The German nurses watched as their former allies were granted new privileges while they remained under tighter restrictions. This pragmatic approach, which judged individuals based on their current level of cooperation rather than their past allegiance, stood in sharp contrast to the rigid doctrines of Nazi ideology. Italian nurses were soon working freely, while the Germans who clung to their Nazi beliefs remained under guard. Despite their status as prisoners, the German nurses received a medical education that surpassed what was available in their own country. American officers freely taught them new techniques, explained the use of new medications, and provided instruction on the operation of advanced equipment. This knowledge was shared without any restrictions. They learned about burn treatments developed from experience in the Pacific and surgical innovations from the battlefields of Europe, all of which was taught to enemy personnel. The German nurses documented everything, fully aware that they would be returning to a devastated nation in desperate need of their medical expertise. As the war drew to a close in May 1945, American authorities began to prepare the German medical personnel for their eventual repatriation through a series of comprehensive training programs. These courses covered public health, epidemic control, and emergency medicine, all skills that would be vital for rebuilding Germany's shattered medical system. They were taught water purification techniques, how to conduct mass vaccination campaigns, and how to treat malnutrition. As Colonel Richard Stevens told them, "You are returning to a situation of massive medical need. This knowledge is our investment in a future democratic Germany." The training also included practical instruction on how to establish clinics with minimal resources, how to train auxiliary personnel, and how to implement public health measures. The German nurses were even issued certificates that documented their American training, credentials that would prove to be invaluable in occupied Germany. The German nurses who returned home between 1945 and 1946 discovered that 60% of Germany's hospitals had been destroyed. They brought back with them not just American techniques, but a fundamentally different philosophy of medicine. Former prisoners of war went on to establish nursing schools that emphasized patient advocacy over ideological purity. American protocols were put into practice in the newly rebuilt facilities. Blood banking systems were created that copied the American models. The systematic use of antibiotics was introduced, following American guidelines. By November 1945, with only a minimal number of American medical personnel left in Germany, these American-trained Germans had become essential to the maintenance of public health. This influence extended far beyond the immediate post-war period. By 1950, many of Germany's leading nursing schools were being run by former prisoners of war. They introduced concepts they had learned in American camps, such as nursing diagnosis, patient advocacy, and the importance of continuous education. German pharmaceutical companies began to adopt the quality control standards they had observed while in captivity. Hospitals were reorganized based on the American models they had witnessed firsthand. The transformation from an ideological to a scientific approach to medicine had become permanent. The statistics reveal the sheer scale of this transformation. Out of a total of 371,683 German POWs in the U.S., over 200 medical facilities utilized German staff. Over 100,000 hours of medical education were documented. Hundreds of thousands of medical procedures were performed. At least 15 nursing schools were established by the returnees. Dozens of hospitals in the U.S. zone were reorganized along American lines. Every single trained nurse went on to influence dozens of their colleagues. Each reformed hospital treated thousands of patients. The ripple effect of this experience multiplied exponentially. In 1995, a group of surviving German nurses who had been held in American captivity drafted a joint statement. "We served the Nazi regime, and we became prisoners of the Americans. We witnessed how medicine, when corrupted by ideology, becomes an instrument of death, while medicine that is based on science and compassion serves life." The Americans showed us an abundance that was beyond our imagination: medications, technology, and resources. But more importantly, they demonstrated a form of medicine that was devoid of hatred. They treated their enemies as patients who deserved the same level of care. We returned home carrying more than just medical knowledge. We brought with us the understanding that the act of healing transcends both nationality and ideology. To all future medical professionals, never allow medicine to serve ideology over healing. The American doctors and nurses taught us this lesson by treating their enemies as human beings who deserved compassion. We arrived as prisoners. We left as witnesses to the true purpose of medicine. The transformation of German nurses in American captivity stands as one of the most successful ideological conversions of the Second World War. They witnessed not just a superiority in technology, but the fundamental purpose of medicine: to heal without discrimination. Their journey from being servants of Nazi medicine to becoming advocates for scientific medicine demonstrates the power of experience over propaganda. Daily exposure to American medical practice achieved what force never could: a complete ideological reorientation. The 9 nurses who emerged from the underground hospital in Sherborg on July 2, 1944, were representative of the thousands who would undergo this same revelation. They entered captivity with a firm belief in German superiority. They left with the understanding that medical excellence is born from science, resources, and universal compassion. This was America's greatest medical victory, a demonstration through daily practice that humanitarian medicine will always triumph over ideological medicine. The German nurses were not simply captured. They were converted through the act of witnessing medicine's true purpose. Their conversion helped to lay the foundation for the reconstruction of post-war German medicine on humanitarian, rather than racial, principles. In their transformation lies the proof that even the most thoroughly indoctrinated minds can be changed when confronted with the undeniable evidence of a better way. The German nurses captured by American forces discovered that their enemies possessed not only superior resources, but also a superior medical philosophy. They had been taught that medicine existed to serve a racial ideology. They learned that medicine exists to serve humanity. That singular lesson, learned in American captivity, would go on to reshape German medicine for generations to come. Their story stands as a powerful testament. Medicine that is based on science and compassion will always defeat medicine that has been corrupted by hatred and ideology. The captured became witnesses. The enemies became colleagues. And through their transformation, medicine was returned to its proper purpose: healing without borders, science without prejudice, and compassion for all who suffer.